Ladies and gentlemen, good afternoon. We are about to start session 6, Public Policy Resource Challenges in Health. And we have Valerie Wilson from Caribbean Laboratories, Resourcing for Sustainability. Jamilia Harris and Alex Jones. Alex Jones will be doing the presentation on drivers of health expenditure. Mr. Don Charles, a global value chain analysis of offshore medical universities in the Caribbean, and Mr. Roger McLean, an assessment of the financial dependence of the Caribbean's response to HIV. We start the ball rolling this afternoon with Ms. Valerie Wilson, and she has been the director of the Caribbean Med Labs Foundation since 2008. She holds master's degrees in immunology and business administration and has had extensive training and experience as a public health professional. Ms. Wilson previously served at the Caribbean Epidemiology Center as laboratory manager for CAREC's Regional Reference Laboratory and later as project manager for the EU-funded Medical Laboratory Strengthening Program from 2002 to 2007. Her work over the last 20 years has focused on implementation of standards and improving lab management and quality management systems in laboratories within and outside the Caribbean region. She has served as a volunteer on the Clinical Laboratory Standards Institute Global Committee. Let's welcome her as she presents this afternoon.
Good afternoon, ladies and gentlemen. I stand among all these economists as a simple lab person, just highlighting some of the issues that are really impacting on labs within our region. I'm just going to give you a little background to how we actually collected the information I'm going to be presenting to you under our Global Fund project, and to highlight some of the issues related to Caribbean laboratory services. First of all, their importance and achievements and the challenges to sustainability of service. And I'm going to focus a lot on that because that's what this session is about, and some of the remedial interventions that are underway. The Caribbean Med Labs Foundation is a not-for-profit, non-governmental organization established in 2008 with a mission to promote and support the achievement of quality lab services in accordance with appropriate standards through advocacy, resource mobilization, collaboration, research, and education. And it came on the heels of that project that was implemented when I was project manager at the Caribbean Epidemiology Center for Laboratory Strengthening. Under this Global Fund project that we've been implemented since 2011, we've been strengthening regional and national networks to support HIV-related services by doing assessments, by developing plans with laboratory for national laboratory services, training and quality systems improvement, lab information management improvements, and developing national laboratory policies to guide and sustain lab improvement efforts. And you know, it's really important for us to look at what is the value for money in terms of labs. Approximately in most countries, not just in this region, but in many countries, 5% of the national budget, health budget, is what is expended on lab services. And yet, laboratory data influences 70% of clinical decisions for NCDs, diabetes, cancer, heart disease, etc., for communicable diseases, HIV, TB, dengue, CHIKV. All of these are diagnosed with laboratories. And in fact, people have actually done studies that prove that 70% of the decisions generally are influenced by lab results. And for the past 15 to 20 years, there have been major investments, more than 20 million US dollars in laboratory services through regional and international agencies and donors throughout the region. There's been major emphasis on expanding scope, access, and quality building strategies. Ministers and officials have endorsed strategies and commitment for licensing, strategic plans, sustainable funding. But we really need to look at, are we making an impact? And we need to measure, are we really making an impact in this area? The role of lab services in meeting, for example, the targets that have been set by the HIV programs throughout the world for 90-90-90, that 90% of the individuals who are infected will know that they are infected, 90% would have, of those would be on treatment, and 90% of those people on treatment would be virally suppressed. Now, each of these 90s is actually determined by a lab test. That's how we know if someone is HIV infected, that's how we know if someone needs to initiate treatment, and that's how we know if they're virally suppressed. In addition to that, we have all kinds of other things, opportunistic infections, monitoring of the patient's safety for people who are on long-term treatment, and identifying drug resistance and treatment failures. So labs are integral to all of this. But we have some real challenges in the region. We're a small region. We have very small, fragile economies. I think you probably know that better than we do. And there is such slow progress in achieving and sustaining lab quality improvement. So we need to really look at what are the strategies that we're using. Here are some really startling realities. This is on the internet. Can be found right there. September 2014, $9 million HIV error. This is one of our countries in the region. Government had to pay big for a wrong diagnosis. A woman was diagnosed as HIV positive while she was pregnant. She was treated. She had a test done in 2005 when she was pregnant, which said she was positive. A second test in 2007, which said that she was negative. And they discovered at that point that she was actually negative. She had to undergo all the shame, pain, loss of her relationship, and her baby was born blind. She's now telling the government 9 million is not enough because, in fact, my child was born blind as a result of the medication that the child was given. Recently, this is 2015, just within the last couple of months, a state lab mistakenly declared 8 mothers HIV positive. So we're seeing that labs in the region are costing a lot of money that has nothing to do with the actual provision of the lab service itself in terms of the cost, but the issues that arise out of the issues of quality with the labs. When we look at costs as well, we can see, and I'm using HIV because the project we've been doing is related to HIV. The lab reagents have been increasing, if one looks at lab testing and lab costs, 5 to 10% per year over time. And lab supplies have been going up 5 to 15%. And along with that, we've seen a huge reduction in the cost of pharmaceuticals for treating HIV. So we're seeing 80% reduction on average in terms of the pharmaceuticals. So we pay a lot of attention to the pharmaceuticals, but unfortunately we can't give the drugs without the lab tests. And somehow that message doesn't get over all the time. In another country, we have, the whole cost of testing, and I know Roger is going to be covering a lot on the cost of HIV programs, but this is just an example that's looking at the rapid testing program in one country, which is completely dependent on donor funding. And of course, the donor funding in the region is coming to an end. We also see the pattern of lack of service, where services are being interrupted in terms of the access to lab services, reagent stockouts, equipment downtime due to unpaid invoices and lack of equipment service contracts. This is a reality for another country, and it's not unusual for many of the countries in the region. Sorry, I went the wrong way. And what is really interesting is that this particular country has a problem with funding the public sector, but meanwhile is having to pay fees to the private sector for the work that they're paying public sector workers to do, but they can't buy reagents for them to do it. So they're actually owing money to the private sector as a result with a huge outstanding debt. So these are the kinds of things that we're seeing. Interruptions in service, interruptions in service, interruptions in service. So this is the picture that we're seeing throughout the region in terms of lab services. Meanwhile, international health regulations are saying that we must have policies that are actually ensuring that lab services are adequately quality assured, that there are good coordination for lab services, etc. So these are international health regulations that all the countries in the region have actually bought into. So we had, under our project, developed a national laboratory policy framework that was endorsed by the chief medical officers in April last year and by the health ministers in September 2014. And they endorsed it and asked countries really to embrace, developing these national lab policies at their country level. The components of these policies include areas that deal with lab governance and network structure. It's amazing to think that in 2015, most of our countries are actually functioning without any requirements for labs at the national level. You can open a lab like you can open a parlor. You can just go get a business license and open. This is the reality for most of the countries in our region. Quality management systems are included in the whole business of ensuring that we have the efficiency and improvements in quality that result from licensing. The policy also includes guidance for laboratory support systems, including procurement, looking at how we can actually make better use of our resources, how we can better ensure the maintenance. This is another one of those big things that causes labs to go down, maintenance of the equipment, and safety and biosafety, which really came to the fore when we started looking at things like Ebola last year, and what the region and the region's response to having to deal with the potential introduction of something that could be really a huge biosafety issue. And of course, the whole business of information and data management is also covered under the policy to deal with how lab information feeds into health information systems. So we have had these policy consultations in 11 countries, 12 countries actually, because we just completed 2 this week, and the Bahamas is planned to add, and we had with the PAHO HIV office in 2014 done some of the overseas countries and territories. So the policy consultations are happening. The real key is, are they going to be implemented? Because often things are endorsed, things are agreed, policies may be set, but the implementation is really key. This year at the COSOD of Health Ministers, the ministers again noted and congratulated. They had an update on what's been happening with the policy initiative that they agreed to last year. They congratulated countries for the progress made in developing the national lab policies. They committed, again, to providing leadership at the national level to support the adoption and implementation of national laboratory policy, which is critical to meeting IHR requirements, because it is a requirement of the IHR, and to ensuring reliable and sustainable national laboratory services. If we are to sustain services, we have to change the way we do things. And they also committed to ensuring the required quantum of human and financial resources to ensure consistent, uninterrupted, reliable testing and information generation, given the reality that it actually is 5% of the budget that is influencing 70% of the clinical decisions. So it really makes very good economic sense. What are the implications? Well, basically, labs really need to provide quality service. They need to manage their costs and wastage effectively and track real costs. These are not things that labs in the public sector are accustomed to doing. Private sector labs do this all the time, but public sector labs don't. They need to engage in outcomes research to show the lab impact on patient health and cost of care. Governments and administrations need to recognize that labs are not a cost item. Their value cannot be measured in whether lab testing makes a profit. That is not what it's about. One wrong result can reverberate across the entire health system and cost more than the annual lab budget. That's the reality of the kind of litigation that we're seeing emerging within the region. Labs are really an investment that make good business and economic sense. They impact on patient in-stay and recovery. I don't know how many of you are aware of the times when, in fact, people are kept in hospitals awaiting lab results. They increase national productivity, growth, and development through ensuring that people actually manage their healthcare better. And at the regional level, we need to advocate with governments to secure and sustain lab budgets, negotiate joint pricing for common lab supplies, advocate for the adoption of national laboratory policies, continue to emphasize quality and support for labs to improve quality, and support lab costing studies to improve to provide data for action in terms of ensuring lab services. The risks of ignoring the signs, and I think the signs are very clear. We would have stockouts, we'll have equipment downtime, we'll have suspension of testing, loss of clinical services as a result, loss of public health capacity, vulnerability to disease outbreaks, inability to meet our international health mandates like international health regulations, loss of things like tourism market share, which is very important to many countries in this region, higher national health costs, and we can see where that is coming because of the ways in which lab testing has to be contracted out, for example, or litigation causes costs, and declining productivity and economic viability. So we need to know that while labs are invaluable in this economically challenging and competitive time, change is really critical. We need to be alert to that. Thank you very much.